Donald Trump has been in office for 43 days, and he's already been keeping the American people and the media busy watching all his moves from tariffs to Doge. There's a lot to discuss and maybe even a lot to be concerned about. My name is Ruben Davis, future doc, third year medical student. And in today's video, we're going to talk about the Trump administration and the impact that some of their moves can potentially have on the field of healthcare. Uh, Obviously, as someone who's aspiring to become a doctor, working to become a doctor, some of these things are a little bit concerning to me. Some of them could directly impact me now and going forward, but more so could be impacting you all who could be potentially in the field right now. For example, if you're dealing with that measles outbreak in Texas, and I think there's been a reported case in New Jersey as well, or dealing with the bird flu as somebody in the public health field, or working for the FDA, or maybe you used to work for the FDA, now they're trying to hire you back. All these different things. So I just wanted to talk in this video about what's been going on and what kind of I'm seeing, and really just start a conversation with you guys. Because disclaimer, this is not a political channel. It's an educational channel, and I just really want to have a conversation about what's going on and really hear from you guys. So please, leave a comment down below. And while you're at it, like this video, subscribe to the channel for more content like this, or just follow along with my journey through med school. I'm in the throes of studying for step 1. I'll be taking it next week, actually. So stay tuned for some content for that. But let's just get into it. So let's start with the Department of Education. And I think this is the one that's, has me, I would say, the most immediate concern, because I'm in school right now and I rely on loans from the Department of Education. I am kind of reaching my limit, I will say, because I did undergrad, a master's, and now I'm in medical school. And let's say it's not cheap. I am someone who is well over $100,000 in debt at this point. That's the first time I've actually said that on this channel. And before I wasn't necessarily concerned, because, the Department of Education gives very loaner friendly loans, to be frank. And they have programs like public service loan forgiveness and other loan forgiveness programs and income-based programs that allow you to pay your loans back and not be super concerned. I'm also going to be a doctor. So, I have a little bit more income than, maybe the average person out there. But with Donald Trump and Secretary McMahon basically saying they want to eradicate the Department of Education, that potentially has me concerned. And they've already said that. Dr. Trump has said that, he told Secretary McMahon, like, hey, I hope you do so well that you have to fire yourself. And she, I think, just got confirmed yesterday officially. And she sent out an email basically saying, hey, we need y'all to lock in for the final, mission of the Department of Education. So they're full throttle with their mission to get rid of the Department of Education. But what does that really mean? What does that mean for me? What does that mean for you? And particularly, what does that mean for those pre-meds who tend to make up the large people that watch this channel, and those pre-meds who want to become doctors? Like, how can this affect you? Particularly with loans. The Department of Education obviously gives out subsidized, unsubsidized loans, Pell Grants, all these different things for students to go to college. And college has become insanely expensive. And maybe that's partially by the federal government bankrolling these large institutions with loans for people to go there. So maybe it's help with prices, but there will be some impact to that. Firstly, let's just say your loans won't disappear. Let's start there as well. So if you already have loans, your loans will not disappear. They will likely just move to a different agency. So, they already say, the Department of Education functions like a bank giving out all this money. So they might move it to Treasury, but the mandate is different for the Department of Education versus Treasury. Treasury is like, we're trying to manage the government's money, trying to bring in revenue, all these different things, handle GDP, blah, blah, blah. But the Department of Education is like, we want people to go to school, get educations, become, functioning people in society that contribute to society that way, rather than like directly giving money back to the government. So, they have more loaner friendly practices, whereas Treasury might not adopt that. There's already been reports that I've read of, Republicans who want to do away with public service loan forgiveness, want to do with some of those other income-based programs, all of that, get rid of all of those. Definitely, I know the SAVE program that President Biden put into place is already in the courts, and I don't know what'll happen with that. But that, these things could have ripple effects ripple effects on an already strained healthcare system, where you have physicians, nurses, pharmacists, the whole spectrum of people that work in healthcare who get loans from the government to go to school to pursue this calling. And it's not cheap. And you fully expect to come out on the other end able to pay your loans, but there's as particular family physicians, who don't make as much money. Those programs are everything. You're getting programs for working in underserved communities. And I know the Academy of American Family Physicians, they, sent a letter to Congress or to the president, I believe, talking about, tax exemptions and different things that they like the government to do and add on to these programs rather than taking them away. So that's a bit concerning as someone who's has to take out more loans. And then when I get to the point where I got to start paying these back, starting in residency, I'm not going to be making that big doctor money. I can be in residency from 3 to 6 years, potentially, depending on what I decide. I'm still undecided. We'll see, what I end up, but I'm making maximum like 80K, but that'll take a while to get to that. Like every year my salary should go up, but I'm making 50 to 80K depending on where I live. And you're expecting me to pay these loans back, where it's like, so getting rid of those programs could definitely, put a strain on me personally, but also on the medical space, where if you're a pre-med and you get rid of some of these programs, and they're also talking about privatizing it, where you have to get private loans, and these loans aren't as friendly, higher interest rates, all these different things, no loan forgiveness programs. If I'm a pre-med thinking about becoming a doctor and I don't have a family that can pay for my schooling, that might make me think twice about going into this field. And we're already seeing, on the one hand, since 2020, I did some research, and college enrollment has been going down steadily every year. I think it's down like a little over 11% since 2010, college enrollment. We have a shortage of physicians already, and the AAMC put out a report last year projecting the 2036 will have an even more severe shortage. And practices like this, where it becomes more difficult to attain that medical degree, could put an even bigger strain and even bigger shortage out there, in particular for family physicians. People who might even want to be a family physician might choose to do something else, just because it's like, I can't pay my loans back. You're getting rid of publish over loan forgiveness, all these programs that allow me to pay my loans back so that I can serve the American people and, contribute to society. I can't do that. I can't sustain a living like that. And so that could have long-term impacts. I mean, of course, hopefully not. Hopefully, something comes in and fills the gaps, and, we're able to do those things. So yeah, those are just some of the impacts that I'm potentially seeing long-term, short-term, that the Department of Education, getting rid of it could potentially have on healthcare, just from a manpower perspective, and funneling doctors, nurses, dentists, pharmacists, all these different people, and even all the other ancillary positions in the public health space. We could potentially see a larger shortage in a country that doesn't really handle healthcare in the best way. So hopefully these things, they handle it with more care, and I don't know, hopefully we're able to come out on the other end of this and not be in a massive shortage for physicians, where we see physicians already with tremendous burnout. You can go on YouTube every other day and probably see somebody who is quitting medicine and going into something else just because of the burden. We saw the burden on emergency physicians when, COVID came, and all those different things. We need more, not less, nurses, doctors, and everybody else. So that's something that I'm seeing. Hopefully, that doesn't happen. Comment down below, like, your thoughts on this. If there's anything I missed, some information that you might have, or just your perspective on it. I love to read your comments and really get more perspective and have a conversation about this, because I'm very fascinated about this, because this is one of those things that could directly impact me and my ability to do the things I want to do. Next up on my list of concerns is the Department of HHS, Health and Human Services, headed by none other than RFK Jr. Um, I have my thoughts on RFK Jr. Uh, and his thoughts on, I'll just say, science. And let's just list a few of the agencies that are under HHS. So we have CDC, Medicare, Medicaid, FDA, NIH, Indian Health Services, and they're, more than that. These are just a few that I'll name. And with that, we're in the midst of a measles outbreak, and the head of that department, who would be, helping to handle and maintain and all those different things, provide resources and support for the measles, has been documented to be and have anti-vax ideology, where the measles is a wholly preventable disease with vaccination. I believe it was in the year 2000, we declared it eradicated because the vaccine is that effective, where nobody was dying, all these different things. And there was a comment he said in the Joint Chiefs meeting about, when somebody, child unfortunately passed from it. And he was like, he was kind of brushed it off a little bit. And I will, credit to him. He's now, I guess, sort of recommended the vaccine, or he's really just said people just should go talk up to their physician about getting the MMR, whereas like you should just flat out say like, hey, this could have been prevented with you getting the vaccine. So that concerns me, in addition to the fact that Doge and President Trump are making massive cuts to these agencies. The FDA, who is handling, obviously drug safety, but also I believe they're the ones handling the flu, the bird flu problem that we're having right now. They fired some people who were handling that, and now they're trying to rehire them, and everything just kind of being done sloppily. And these agencies are about safety, prevention, and with that being said, like when you're doing things sloppily in this regard, like there are literal lives at stake here when you don't have the right people in place, when you don't have the right information and research and all those different things. And so the things that they do now could cost lives in the future, where you're slashing NIH funding for colleges and universities and other organizations and people that just work at the NIH who are dedicating their lives to research that will better people, because people were doing research on COVID before we had the pandemic, right? And so imagine if we didn't have any of that research before, where it's like everything's novel, everything's new, we would be even less prepared than we were. And there's actually even another agency about preparedness for crises that RFK Jr. would be overseeing. And so it just concerns me if we don't have the right people in place, and if we're firing people who would do that. So my question would be like, coming down the road, like even when we have a new president 4 years from now, how much damage have they done? If there was, this is obviously speculation, I leave room for optimism that they will actually turn things around and actually do a good job. But what will happen, let's say they cut everything, don't replace or replenish stockpiles of tests, and and we're not doing the research on these things, trying to stay ahead of things, and we're just being reactionary. What happens when another pandemic comes around? Are we going to be prepared? Will it be worse? Will more people die? So that's concerning. And then on top of that, as physicians, I'm not a physician yet, but as a physician, physicians rely on information from the CDC and research from the NIH and recommendations and things from the FDA and all that stuff that the secretary of HHS, he listens to all of that and then puts out recommendations for physicians and families and all that type of stuff. And so with that information, it's like, can we trust that information? Will they withhold information because RFK is shown to be a little anti-science? So there are just concerns in there, and just how that'll work. I think a lot of it will start to fall on the academies of different specialties to start to really engage in their own research and making sure that they're informing their physicians in their academy, so pediatrics, OB-GYN, all those, where they're starting to take on that mantle because, you know, they're trying to reduce all of that, and it might fall to the states as well to maybe invest in research and different things. But it's been done this way for so long that states and, you know, those agencies don't have that type of infrastructure that the federal government has on that large scale. Especially with like the CDC, for example, when things happen, they have national coverage of things, and they're able to send out epidemiologists and track stuff and with much better efficiency than other agencies, because that's just what they were designed to do. That's what they've been doing for years. So I just have concerns that going forward, a lot of those things will be dismantled, and maybe we won't be as prepared for crises in the future. Maybe we won't have the most robust research going forward that can, you know, prevent disease and cure disease and, you know, all these different things. So we'll see how that goes. I will say, and on a more, I guess, positive note of, you know, federal government investigating United Healthcare for potential fraudulent practices with their way they're billing Medicare. You know, they've been overbilling and, you know, labeling diagnosis a certain way so they can get more money from Medicare. And so hopefully that yields fruit, and we get some justice on that, and, you know, those funds can be returned and, you know, doled out to the American people and just used for better use. All right. So I did want to kind of end on a positive note. I know I'm kind of talking about all my concerns here, but I'm really curious to hear, you know, what, you know, you guys think, and especially physicians who are currently practicing, who may see some impact already, or who have better experience to foresee what potentially could happen than I do. I'm really curious as to what your thoughts are on some of the things that I've said in this video, what your outlook is for your own practice going forward, and what you're doing. If you have any recommendations for other physicians, like, hey, you should be doing this to, you know, protect yourself, protect your patients, all that type stuff. So yeah, I'm really interested to hear what you guys have to say. Please leave comments below on this video. I'll be, you know, reading them, responding to them. Hopefully we can get some robust conversations going on about what's going on in our country right now. Like I said, I remain optimistic, you know, because, and I will, you know, point things out and, you know, try to say things directly, but whether you like it or not, Donald Trump is president. Whether you like it or not, all the people he appointed, the Senate, are confirming them. So the only thing we can do is continue to advocate for ourselves, protect ourselves, whether it's in, you know, the financial markets or, you know, as physicians, doing the things that you need to do to keep yourself safe, keep your and prosperous, and keep your patients safe and healthy, and continue to just advocate, you know, try to work with people, try to do what you can. Yeah. So I am very optimistic. I'm not going to just say, oh, it's all going to come down tumbling and crumbling, because I think there are still people involved who want the best, you know, and will hopefully make sure. A lot of them are quitting. A lot of people are quitting. A lot of people getting fired, but, you know, we'll see. Hopefully things can still function. I guess I'll say function, and we come out on the side bigger and better as a people. So that's all for this video. Ruben Davis, Future Doc here. Make sure you like, comment, subscribe. Future Doc out.